Hello, everybody. Assalamu alaikum. This is the Infection Control Committee of the NICU of Maternity and Children Hospital Tabuk speaking about hand hygiene inside NICU. Hand hygiene play a vital role in prevention of the infection for both the patient inside NICU and the healthcare provider. There are 5 moments recommended by WHO to wash your hand. The first one is before touching the patient. The second one is before doing any procedure. The third one is after doing the procedure. The fourth one is after touching the patient. The fifth moment is after touching the patient's surroundings or belongings. It's very important to please remember that proper hand hygiene starts with the preparation. The first step in the preparation is removing your accessories, such as rings, watches, bracelets, artificial nails, and anything else. Please, if you have long sleeve, please roll it up to your elbow. And prepare soap and water if you are doing soap and water hand hygiene, and sanitizer if you are doing alcohol-based hand sanitization. You also need either towel or disposable tissue to dry your hand after your hand hygiene. The first step of a proper hand hygiene is to wet your hand by soaking it in the water. You can use warm or cold water, depend on the preference. Then you need to apply enough amount of the soap to enough to cover the surfaces of both hands. After applying enough amount of soap, please scrub your both hands thoroughly for a good period of time, between 20 to 30 seconds, and the longer the better. Start by rubbing both palms of opposite hand together. Then rub the back of the hand using the palm of the opposite hand, including interlacing the fingers. And then rub the fingers and web spaces of both hands together. And then move to the back of the fingers by locking the fingers together and scrubbing their back against the opposite hand from side to side. And then move to scrub the thumb of both hands. And finally, try to fingertip and nail by rubbing the fingers against the opposite palm in a circular motion. And then try to clean both wrists, both ventral and dorsal surface of both opposite hand. After finishing proper and enough period of scrubbing your hand, dry your hand. You can use towel, but the best way is to use disposable tissue. Another way of proper hand hygiene is to use alcohol-based hand sanitizer. We follow the same steps of hand hygiene with soap and water. However, in this type of hand hygiene, we need to dry the sanitizer in the air. Without drying it, it will not affect. So when you see your hand is dry, that means the effect of the sanitizer took place. Please remember that proper hand hygiene helps reducing and preventing risk of infection for both patient and the healthcare provider. Thank you for listening. Welcome to NICU without infection. Assalamu alaikum wa rahmatullahi wa barakatuh.